You've heard the symptoms of COVID-19 include fever, difficulty breathing, and coughing. But many are now asking about fizzing. What is that exactly? We asked the experts today. KOMO's TAMMY MUTASA is live in the newsroom with the answers. Tammy?
Yeah, Molly, there's reports of a new fizzing symptom emerging in COVID-19 patients, and they're experiencing it in their body. Doctors say it's actually not far-fetched, and more unusual symptoms are developing too. Fizzing is one of the latest COVID-19 symptoms making the social media chatting rounds. It's described as a strange buzzing sensation felt throughout the body of a COVID-19 patient. This person sent me a message on Facebook asking if the medical community has heard of it, saying, if so, would these people be considered contagious or would possibly have antibodies? I asked UW infectious diseases doctor Paul Pottinger.
We're seeing more of these unusual manifestations. I think it's real. I think this is the body's immunologic response to a systemic infection, and for whatever reason I cannot explain, some people do feel these odd symptoms, what you call fizzing, a buzzing sensation under the skin. I think it's real.
Doctors say people have been reporting other uncommon COVID-19 symptoms, including loss of smell and taste, aches, diarrhea, dizziness, but for some, no symptoms at all. To answer the question if people with this fizzing symptom would develop antibodies, Dr. Pottinger says testing could be an answer.
I would be very confident that they would be able to build some kind of a durable immune response as much as somebody who has a respiratory infection, but it's too soon to know. I'm guessing that that's going to be the case, but we're not going to know the answer to that for some months to come until we can do more widespread serology or immune testing of all these different patients.
A lot of people who canceled flights because of the coronavirus say the airlines are making them jump through hoops to get their money back.
Consumer watchdog groups say that is not acceptable. Consumer problem solver Connie Thompson is live with a new campaign to get the airlines to stop forcing people to take vouchers they don't want. Connie?
Well, in many cases, they can't use the vouchers because the trip that was canceled was a one-time event and they don't have any plans to fly in the future. And what really burns a lot of people is that airlines are keeping consumers' money and at the same time accepting billions of dollars in public money in the form of a bailout.
The fact is the airlines are trying to hold on to your cash. And we have found at Consumer Reports that it's become a real problem.
Within days of asking its members to share their stories, Consumer Reports' new airline refund page was flooded with more than 2,400 accounts of refund tug-of-war.
Some readers are saying they had to jump through a lot of hoops. Eventually, they had a happy ending and they got a refund, but they had to, wait on hold for 4 hours, or they had to call multiple times.
Consumer advocates say with airlines set to collect $25 billion in free government bailout money, plus another $25 billion in potential government loans, they should not be allowed to keep payments for flights passengers never took. Travel expert Steve Danachek says even as a pro in the business, he's out $1,000 deposit that he paid to a tour operator who booked his flights to Peru.
And because it's not healthy there, we can't go next month. We're asked for the money back, and they're saying, well, we can only give you credit for next year. I have no assurance they'll be in business next year.
If you face a cancellation refund shuffle because of the pandemic, consumer advocates say contact your representatives in Congress and tell them about it.
And I think, it's a fair point to say, look, my tax dollars are paying for this bailout, and the airlines are holding on to my money. And as I noted, it's not even a question of, well, you'll be flying next year. In many cases, people have no desire to fly now.
The streets of Seattle are quiet. Social distancing requirements and shuttered non-essential businesses mean less foot traffic and substantial loss in sales for stores and restaurants. To bring back our economy safely, there are a number of possibilities. Congresswoman Kim Schreier tells KOMO's Keith Eldridge it could start with reopening some non-essential businesses. It could mean starting up elective surgeries again.
If we could bring back some of those elective procedures, it would help hospitals, including rural hospitals. It would help patients and it wouldn't pose any risk.
Bringing back construction projects is another option.
Construction. If you're outdoors, that's a much lower risk.
Public health authorities, as well as state and local leaders, say until we find a cure for COVID-19, we'll need to change our behaviors for the foreseeable future.
And I want all those workers to return to the offices, right? And we want them back downtown. We want them there to support restaurants and retail. But I think we do have to accept that there's going to be a phased transition.
That possibly means changes for restaurants, workplaces, and schools. That could mean fewer tables in restaurants to increase physical distancing.
There'll be things that cost money that will cause operators to say, you know, I'm not ready to reopen with these costs still in place. And there'll be others where people can say, I can make this work.
And employers are going to look at sort of reducing the density in their workspaces.
Changes could also include staggering school schedules in the fall. It could also mean temperature checks at the entrances of businesses. It could mean more people wearing face coverings in public.
I think ideas are being floated, and I think it's healthy to float ideas.